May buntag Subo, the rest of Central Visayas, kininausap si Rob Cabardo sa Philippine Information Agency, Central Visayas. O welcome sa lain na sang episode ng atong face-to-face kapihan sa PIA. Mayong buntag po sa atong mga solid viewers and followers ng atong programa, and also to our media partners nga niuban na karon lives diri sa atong buhatan sa PIA Region 7. And live data karon pwede ta nilang makita sa atong Facebook page sa Philippine Information Agency Region 7. So mayong buntag kanatong tanan ug karong adlaw aduna kitay paghisgutan kabahin na ning COVID-19. So atong tukion ning bag-o ni tumaw karon nga COVID variant nga gitawag nga XBB.1.5 Omicron subvariant. Ug later on mangumusta pud ta sa current COVID-19 status diri sa Central Visayas. So, aron kita tagaan og dugang impormasyon og detalye kabahin yan ning atong topic, atong makauban karon gikan mismo sa Department of Health Central Visayas. Mahimo siyang suki na sa atong programang kapihan sa PIA, no? So, atong ipaila-ila sa way pagdugay-dugay. So, our guest for today's episode sa atong kapihan sa PIA, no other than Dr. Baton. Siya ang Medical Officer for sa DOH-7 and siya po the Program Manager sa Emerging and Re-Emerging Infectious Diseases. So, Doc Van, good morning, Doc, and welcome once again sa itong programang kapihan sa PIA, Doc.
Good morning, Ragno. Good morning to our viewers, to online, and to our other channels. No? So again, thank you for PIA for giving us the opportunity to provide timely and relevant information para makahimo o maayong desisyon ng ato ang mga katauhan regarding sa issues panglawas o regarding sa ilang mga aktibidades sa mga tumaabot na.
So, we're happy to know nga finally, previously kay online raman to, so karon naka face-to-face na kita. So, unahon ako, Doc, first question, Doc, magabahin sa itong topic, Doc, kaning bago nga variant, sa variant karon sa COVID-19, XBB.1.5 Omicron sa variant, morning name, Doc. So, first question, Doc, like, siguro, usay mga angay mahibawan sa publiko kabahin ni Doc, kung saan siya about, and siguro, I'll ask na sa siguro, Doc, na ma-consider mo siya as cause of concern. Karon nga, we all know nga, ato ang relax naman itong restrictions na ang latest na itong situation rin is like, almost 100% na ibalik na ta back to normal business na ta. But still, hulga kaya po ng COVID-19, especially pag tumawa ng bagong variant to. So, mga tanong ito kung details aning sa variant.
Okay, thank you, Rob. No? So I think sakto good no, we're always wanting to ask new relevant information regarding pressing concerns. No? That for this one, no, Omicron variant and the subvariant, the XBB subvariant. No? So kining latest nga XBB B1.5 is still part of the Omicron, no? So the Omicron is still the variant of concern, whereas the XBB 1.5 is still considered as a variant of interest, no? So muna yung mga labeling sa WHO in terms of para uniform ang messaging across all member states and member countries and all health agencies, no? So having said that, ang difference between the variant of concern and variant of interest is that the variant of concern muna siya ito ang expected to affect policy, no, in terms of kung buhaton, do we have additional response aside sa usual itong ibuhat because naitay nakita na different from this part of variant compared to the previous variants, no, like the Alpha, the Delta, the Gamma, and now the Omicron right now, no. So for now, ang XBB 1.5 is still a variant of interest. So what does that mean? It just means that kung saan nakita sa mga previous subvariant ni Omicron, more or less same lang yan kung nakita sa XBB 1.5. No? Difference lang is natin nakita ng mga examine ng virus na yung mga minute changes pero dili siya enough to have to cause different symptoms. No? Same lang gihapon. Although nakita nato sa mga other countries, no, especially the United States, wherein naghanagin sila karon cases, it's more or less the more dominant subvariant ang nakita ng SPB sa United States. Nagsugod siya last year pa lang. It still is more or less the same symptoms. Wala tayong nakita na increase in deaths, no? Meaning kato mga natakdan na niya regardless if it's vaccinated or unvaccinated, more or less same lang yapon na yung mortality rate. But nakita na to ang impact in terms of symptoms among vaccinated and unvaccinated, no? So although escape tayo mga certain instances kina kay reinfection, meaning katong mga na COVID karon, matakdan gihapon with this type of variant, ay naapot ay mga nakita nga mga breakthrough infections muni siya atong gitawag nga katong mga bakunado na pero na COVID gihapon, masakita nato nga milder gihapon ang symptoms nato for those who are vaccinated compared to the unvaccinated and to the reinfection. No? So what does that mean? It just means that the mode of transmission is still the same, so it still would be the same. If it's the same mode of transmission, it would mean pareha man gyapon ang ato ang mga buhaton para malikayan ang pagka-infection. No? So masks do still work. No? That is why even with loosening of restrictions sa mask wearing, the Department of Health has not wavered in terms of pushing for people to still wear masks if necessary, especially if it's indoor, poorly ventilated, and then daghan ang tao na nagtatapok, and you're not aware or you do not know what are the exposures to these individuals. No? So mo lang gihapon natin mention ni DOH. And then hand washing is still very essential. I think for all infectious diseases, not just COVID-19, the WHO still also recommends that hand washing is still the #1 protection against getting infected diseases. So that is what the XBB 1.5 variant is, and that is the Omicron variant. Looking also at our cases, it would still support our idea pareha lang yapon yung transmissibility because we have not seen a surge in cases in terms of our detection sa ato mga testings, no? In fact, no, lesser ang ato ang cases this week compared to last week. No? Although by 30%, no? Although natin mga biases and cases, no? Kaya karon, no, di na kaayo ingana kapaspas magpa-testing, no, sa ato mga katawhan ug naay mga gagmay sintomas ato ni associate dayon with sipon. So that might have played a factor in terms of why we are having a lower number of cases compared to the previous weeks. But based on our surveillance also for mga flu-like infections or flu-like illnesses sa atong community, we cannot also see an increase in symptoms po. No? So that would mean nga ikatong mga naka-escape po or wala na itong testing, makapture na gihapon nato sa atong other surveillance nga that's our influenza-like illnesses and your flu-like infections in our hospital. So far, dili lang siya kabalakaan in terms of mas dali pa matakdan or mas grabe ba ang sintomas. What we are seeing right now, ako yung i-frame siya, i-premise sa atong nakita karon, no? Kay as what we've seen in the past 2 years, no, very fluid ang ato ang mga makita sa atong mga researches and atong mga examinations sa virus and sa symptoms ng mga tao. But for now, we are not seeing an upward trend of cases. Even with ato ang mga pagtiyok sa atong mga tawhan, no, sa pre-sinulog parties and then sinulog, we haven't still seen it. Although the Department of Health Regional Office in Central Visayas, we are closely monitoring the cases that we have for in the next weeks, no, especially following the major activities of sinulog, not just in Cebu City but in other areas of the region also.
Naka-mention ka about detection, Doc. Like, ang pag-detect kaning specific na sa Omicron sa variant, Doc, like, nabay kalahian sa katong mga other variants or katong regular nga COVID variants in terms of testing? Like, siguro, usa man sa pinaka-importante para ma-manage nila to is to kanang detect first. So, unsay kalahian?
Yeah, no. Actually, still this is following the same process. We send out samples to the Philippine Genome Center and UPPGH, no, to conduct the genomic sequencing if this is if there are any mutations, no. So it's the same process. So far nakita nato nga for the last surveillance report ni gihatag sa ato sa Philippine Genome Center, wala tayo na-detect ng mga variants of concern, be it the XBB or the variants of interest in the region. No? It's coming from other regions in the Visayas area and one also in the Mindanao area. So it's following the same process. In terms of the testing, pa na ito na worry na if there is a very drastic change in the virus, ma-detect pa siya sa ito ang rapid diagnostic kits na muna itong gamitan ng mga RDTs. No? So far, ma-detect yahapon na ito siya. So wala din nakita ng mga virus karon nung dili kayo na ito ma-detect. Although there was one variant of concern that was troubling na siya chances nga hindi siya ma-detect sa mga some certain testing kits, no? But so far for us, wala ta nakita na nga cases sa atong area. We still do regularly submit and prove that we are detecting cases of XBB in the country is proof that we are testing them also. Okay? Kung ma-send natin sa Philippine Genome Center for sequencing, it just means na-detect siya sa ato ang mga surveillance areas in the local government unit areas, communities, and health facilities.
So sa pagkakaroon Dok, wala pa tayo confirmed case sa kaning XBB 1.5 dito sa Philippines Dok.
So far, wala tayong nakita na naana tayong XBB sa region, sa Philippines, no? Naana tayong number of cases. But so far, wala pa tayong nakita ng subvariant, no? Speaking for the regional office also, wala pa tayong nakita na cases dito sa area for now. If ever there are new cases, we'll just update everyone. So I encourage everyone to really check on the validated Facebook pages and other social media outlets of the Department of Health, be it the Regional Office, Central Visayas Center for Health Development, also our PIA partners, no? Sa ato mga nananaw yun, no, o makadumog ano ito ang mga information dissemination, please do check on our website. And especially the Department of Health website, na dito gibutang tanan nga also latest ng mga subvariants na nakita nato, what are the number of cases per region, and what are the variants of concerns that are detected per region. So, actually, sayang lang yun, no, kasi mga katawan, dili nga na kayo ka-updated. We'll try to be more open to other venues, but for now, the website of the Department of Health is always updated, and also the Central Visayas Center for Health Development FB page also provides regular update, and I think and also the PIA is carrying also our social media cards for information, especially natin mga updates regarding various of concern, various of interest, and new cases detected in our areas.
Sakto ginog Dok, kay imong gi-raise nga point gani Dok, kay like ang information gani Dok ang pagkuha. So importante kayo nga ang atong nakuha nga information og na really nakuha sa publiko but is the right information. So ang buhaton lang gyud nato is ato lang gyud ta mukuha og mga impormasyon sa mga kaning authorities gyud Dok, ang mga kaning mga sa government gyud nato sama sa imong gingon Dok, the lead agency, the Department of Health. So naaro may website and Facebook page po sa DOH. So ang publiko pwede ra gyud mo visit dito, naara gyud dito ang mga impormasyon nga kinahanglan nila mahibaw-an. Dok, ako na po dias Dok, since yung mention nakapangtana po ko about the kaning case, confirmed case niya. Hopefully sa pagkakaroon wala pa tayo na detect, but I guess I know the Department of Health wala may hunong gyud ang kaning monitoring gyud ang mga gipangbuhat ni sa inyong agency Dok aron ma-manage gyud hopefully nga dili gyud atong paningkamutan nga dili gyud makasuod, or kung makasuod man ma-manage ra nato og as early as possible. Unsa yung mga specific kaning efforts Dok or mga actions nga gibuhat karon sa DOH Dok, siguro as mahog nga precautionary measures isip pagpangandam. Of course naman tay mga other variants po nga nakasuot, especially karon nga ang setup gani karon Dok nga ang all loose na taron, and then ang mindset sa mga tao ron ba nga inana man, then mura gani ang kumpiyansa na kanita. But of course threat pa man ni siya Dok, ang atong government wala may hunong gid bisag mulax pa ang restrictions na gihapon diya ang efforts sa inyong agency Dok, sa inyong part Dok, unsay ginabuhat niya Dok?
Yeah, thank you Rob. No, so sakto gyud na, no, although ang ato ang mga restrictions currently have been loosened up, especially for tourists coming in. No? I've seen that a lot of countries have already been welcoming tourists, Filipinos going abroad, and also a lot of tourists coming in into our tourist areas. No? So ato na yung gibuhat niya po sa DOH is we are still doing the same things that have been proven to be very effective. What are this? Kato atong gingon, no? Katong vida solution, no? Katong wear of mask, no? Avoiding very crowded spaces. If you are sick, you should isolate yourself, no? Dili ka magsulit-turoy, and then of course it's always the vaccination, no? I think dili na yun nagpapadudahan the impact of vaccination, no? If you have seen the number of cases before we had any COVID vaccines and after we had COVID vaccines, you would see the dramatic decrease in people being admitted in hospitals, no? And also the number of people being infected, no? So makita gid nato nga epektibo ang bakuna. And then all that is still being offered by the Department of Health. So katong mga katawhan nato na wala pa na bakunahan or still are thinking over the fence in terms of getting their booster shots, please do get their shots, no, as soon as possible because it has been proven not just in the Philippines, but other countries as well in terms of the effectiveness of vaccines, COVID-19 vaccines for that matter. No? And also, one is also we still encourage everyone to wear a mask. No? Although, ingon sa aron nga pwede nga dili mag-mask, pwede dili mag-mask, pero pwede gihapon nga mag-mask. No? So, muna ito gilimayan sa atong mga katawan nga, when the government says nga it's no longer mandatory, it does not also mean nga it's not it is against your personal welfare and your family's welfare if you wear mask. Especially kung nakay mga kauban sa balay nga medyo idaran na or wala pa nakuha bakuna tungkol kay dili sila allowed to get vaccines because we do have individuals that are not clear by the doctors to get the vaccine shots. No? So matakdan niya kung sila. No? And also, the Department of Health still is providing vaccines to our local government units and also providing logistics and needed logistics to get the COVID-19 vaccination to everyone that may be needing it. And also, we are still continuing our monitoring no, sa atong tanang cases. So, the Regional Epidemiology Surveillance Unit is still tracking the number of cases. No? So, biskin wala na kayo magpa-testing, we are still offering free testing also, and the PhilHealth also still provides coverage for testing for COVID-19 for those that are manifesting symptoms and do want to get tested for other reasons such as medical procedures. No? So these are still ongoing by the Department of Health as the lead agency for COVID-19.
Okay, thank you, Doc. So, siguro nakuha naman daghan naman itong information, Doc, but we have naman tayong mga bisita po dari coming from our local media partners. Siguro we would like to give them opportunity, Doc, nga mo hatag po sila mga pangutanan ni Doc kabayan sa itong topic. And karon we would like to open the floor for questions sa atong guests from our media partners. Yes, sir. Thank you. Sir John? Yes, sir. Okay, sir. Go ahead, sir.
Doc, nalaka mga clarification regarding sa active cases sa Central Visayas, Doc. Pila ka mo kang atong active cases, Doc, karon o sa Central Visayas sa COVID?
Thank you for that, Sir John. No? So, although this should have been provided as per our surveillance unit, no? But let me just give you the numbers that we have for the month. Weekly na magod ang ato ang numbers provided, no? I think naka-provide ang Facebook page nato for the week this Monday, no? So let me just pull out my data. So total number of cases that we had for the Central Visayas area, natay 51 new cases that we have detected for the week January 15 to 22, no? So 51 cases, average na to for that week is around 7 cases per day. Natin sa nakuha nga severe or uncritical cases and then natin na-verify nga one mortality. No? So again, mortality na to, this is validated numbers, meaning even if namatay siya for that week, it may not yet be part of our reporting because we still have to validate with the official death certificate of the cause of death. So for the week 15 to 22, we have 51 new cases. That is an average of 7 new cases per day for that week. 1 severe and critical and 1 validated mortality.
Doc, sa atong vaccination, asa na ta karon sa atong vaccination, Doc?
Sa atong vaccination, no, kung ano yung tanong, murag, sobra pas kamang no, in terms of the very glacial pace that we have. No? So I think we encourage everyone to really get vaccinated. Although nindot na itong number for our total target population for the general population na sa close to 85%, no, we're now at 84.2%. No? For our senior citizen, we're still struggling. We're still at 60.79 or 61%. No? Although that might be low no, compared to other regions, but comparing to our coverage, the number of individuals we need to cover, we are very one of the regions with the highest number of individuals to vaccinate. No, in terms of our booster shots, we now have a total of 1 million individuals in the region that have already received their booster shots, with additional 3,840 added for the month, for the week January 16 to 22. So although ang ato ang gibutang hatag na mga cases for COVID-19 is 15 to 22, For a shorter timeline of 16 to 22 January, we have added 3,840 individuals who have received additional shots for their COVID-19 vaccines. Sir John.
Last na lang, Dok. Sa
Thank you,
kuan,
sir.
Dok ba, unsay awhag na to sa publiko, labi na sa mga entities kay kani mga bagong variant, daghan kaayong mga nabalaka po tungod sa mga ngayon ubang mga entities, mga individual nga nag-sensationalize po sa kaning nga balita nga na nakapakos nila o concern yung kabalaka. Unsay mong awhag na to nila to? Kung unsay awhag nimo sa publiko, especially sa atong update around sa vaccination.
Yeah, thank you, Sir John. No? So, kanagin, no, the cause of concern should translate into behavior. No? So, dili lang magpabiling kabalaka ang ato ang mga nabati kung na ating madunggan ng mga balita. Dili man pareha sa first year of COVID-19 pandemic no nga makaingon ta nga wala tayong mabuhat, magpuyo ng gitas balay. For now, we had established certain actions or interventions that we've proven effective in the past 2 years that we have been battling COVID-19. Vaccination, good gihapon, Sir John. No? So, for those that have received their booster shots already, thank you. You still need to wear your mask and avoid sick individuals. No? And if you yourself are sick, please do isolate and get tested if necessary. For those who still have to receive their COVID-19 shots, please do get their shots. It has been proven effective. Nakita din natin nga medyo kung maigo ka sa COVID-19 infection, if you're vaccinated and have received your booster shots, medyo ang sintomas wouldn't be that severe as compared to before. No? So kana lang siguro, Sir John, no? So ang atong mga kabalaka siguro dapat ato i-translate into behavior. Ang atong lang siguro hinumduman no kay we don't want only to protect ourselves, but we also want to protect our family and to protect those that we're working with. So kung natin ipamati nga dili maayos tong lawas, do isolate immediately. Wear your mask if you have symptoms of respiratory nature, meaning mag-uubo, magkasing-atsing, nakaisipon. Wash your hands regularly. Disinfect surfaces that are regularly touched in your offices or in your homes, especially nga itong mga kabataan karon nagbalik na sa face-to-face. Wala ta kay cause ng exposure o sa ilang mga ipambuhat while they're in school. So please do regularly sanitize and disinfect any materials that are regularly touched by everyone in the household, in the office. So kana lang siguro, Sir John. No? So always remember that natin mabuhat karon kumpara sa unang tuig sa COVID-19 pandemic. Karon pwede na tayong papakuna, pwede na tayong likay sa mga mga butang na nakita nato that can transmit COVID-19 infection, such as going to crowded places and avoiding sick individuals and isolating ourselves if we ourselves are feeling not that well, from avoiding going to the office or using public transportation or going into anything that would need more individuals to come in contact with you.
Thank you, Sir Jan. Doc, nalapit pa last question, Doc, siguro considering sa mga situation karon ba mahog guro ni nga kaning usa sa mga mahog na nga nag-una nga pangutana especially sa publiko karon yung situation na to, Doc. Ang question ko, Doc, ma-consider na ba ang COVID-19 pandemic or pwede na ba siya i-consider as endemic? Okay. Siguro mao na yung murag nakaroon sa kaning pangutana, usa sa mga takong pangutana sa publiko, Doc, like sa ang nahitabo karon unsa naman like siguro nakoy natunggan nga mag-meeting ang WHO or sa inyo, Doc, sa say sa DOH.
Actually, labeling an infection if it's an endemic, mura og ato na siyang gitan-aw para lang gid malusan up nato nga we can live already with the virus, meaning it's just the normal infection that we get regularly, such as the flu and common cold. No? So that's the context of wanting to label it as endemic na ba siya. No? So kana lang yun. For now, I think we haven't yet received official communication whether the COVID-19 has already been labeled as an endemic. Although if you look at the behavior of certain countries, we're already labeling it as living with the virus again. No? So that's the end goal. So we are just trying to see at what point in time can we really live with the virus, meaning compared to the pre-pandemic behavior that we have. For now, we are still trying to calibrate our response. No? Although we are trying to live with the virus, kasi pasabot sa live with the virus, we have already started opening our schools. We have started loosening up our travel. No? So people are moving around. We have started to loosen up our behavior in terms of social gatherings. So that is one way of trying to live with the virus. Now, in terms of endemic, I think It's just a matter of labeling it based on the data that we have. But in terms of behavior, more or less what we are seeing right now would be the same thing whether we label it as endemic or not. But even if it becomes endemic, we still would live with the same caution that we are looking at right now, because the data that we are showing is that bati ang COVID-19 for those that are elderly, for those that have comorbids. So whether you label it as endemic or not, dili mo yung mulawas nga endemic na ini, so dili nga niya akong respond. So your body wouldn't mind what the label the virus has, because it would still depend on how your body reacts. And the only way we can prevent, we can control is how to prevent getting the infection altogether or lessen its impact by getting COVID-19 shots, wearing masks, avoiding crowded places, isolating when we're sick, and also regularly hand washing and sanitizing frequently touched surfaces.
Thank you, Dok, sa pag-clarify. So, at least sa imong gi-share ganiha, Dok, na klaro gid ba on say like naman ay mga angay pa ganing mga ipang consider nga mga factors. Dok, before we officially end, Dok, our today's episode sa Kapihan sa PIA, I'll give you an opportunity to give your parting message, Dok. Like, na naman kay gi-share ko ganiha, but karon taganti kag balik og opportunity to give your mensahe niya, Dok, in behalf sa Department of Health. Karon nga naa pa man gihapon sa imong giingon, sama sa imong giingon, we're living with the virus. So mensahe, Dok, sa publiko o katong mga siguro katong individual nga wala pa kaning ato ibutang sa ilang vaccine, dili pa complete silang vaccine or atong wala pa ka-booster, Dok. Just your parting.
Thank you, Sir Robno. So again, in behalf of our Regional Director Jaime Espernadas and the entire team in the Department of Health Center for Health Development, and also our Communications Unit and Health Promotion Unit, no? Again, thank you PIA for giving us, Director Payet, for giving us the chance also to provide relevant information to the public. So I think what we just want to remember and everyone to always bring in their mind is that the virus is still with us. We do not know what the response of our body would be. As nakita natin na yung mga very healthy individuals, seemingly healthy individuals, when they get the vaccine, they would manifest differently compared to others that may seem sick or may seem frail and then they survive the virus. So let's not test fate na lang siguro, no? So if we can prevent the infection altogether, let's do it, not just for ourselves, but also for our family and our workmates, no? And the people that we have in the community. So for those who are still thinking about getting the COVID-19 vaccines, please be provided. The Department of Health no longer will be procuring additional vaccines. So once the supplies last, we do not know where we will get vaccines, if you'll be paying for it once you decide to get the shot. Same thing for our individuals who are wanting to get their booster shots. Please to go to your nearest health facility offering COVID-19 shots for boosters, especially for healthcare workers and those caring for very sick individuals who might not be allowed to get their COVID-19 shots. And for everyone, including our children going back to school, please to wear your mask, regularly wash your hands, and avoid individuals who are manifesting or who think or are showing signs of colds and flu, no? So, dili lang ni trabaho sa Department of Health, but trabaho na itong tanan to ensure that we get back on our feet stronger and better, and we remain healthy in 2020.
Okay. Once again, Doc, no, sa atong guest karong buntaga, sa atong kapihan sa PIA, Dr. Van Philip Baton, Medical Officer for sa DOH-7 and Program Manager of Emerging and Re-emerging Infectious Diseases. Thank you, Doc. Once again, Doc, in behalf of our original head coach sa PIA, nga si Mang Payet, Doc, sa paghatag og higayon nga very personal good yun yan sa tong office sa face-to-face kapihan sa PIA. Thank you, Doc, once again. Og sa dili pa ta official nga matapos ning atong episode sa katong kapihan sa PIA, ato lang ipahibaw nga ang Department of Education Region 7 nagpahigayon karon og Mantong exhibit nga nagtanyag sa mga best practices and flagship programs and projects sa pagpatuman sa Basic Learning Recovery Plan sa 20 ka school division diri sa Central Visayas. O ipasundayan po diri sa exhibit ang mga produkto nga ginama sa mga high school, senior high school and TBE ALS students, no? So atong giawhag sa atong mga viewers diha, mga nananaw karon sa live, sa publiko and also sa atong media partners pud, no, nga mobisita o mutan-awan ni nga exhibit to check out ani nga exhibit. Nagsugod ni siya last January 24 o mahuman this Friday January 27. Kini gipahigayon sa DepEd Ecotech Center sudlan Sudlon Lahog, Cebu City, no? So bisitahan ninyo ang exhibit sa DOH-7. Okay. Mao pa to ang ato ang programang Kapihan sa PIA. Nanginaot mi nga doon na kamoy nakudlo nga mayong impormasyon. Og hantod na sad sa sunod nga episode ning atong programa. Usab kini si Rob Cabardo sa Philippine Information Agency Region 7. Daghang salamat ug mayong adlaw.